Hello, and welcome to the Self-Care During COVID-19 presentation. My name is Daphne Quick Abdullah, and I'm with the Los Angeles County Department of Mental Health, Family and Communities Partnership. Some key highlights for this presentation will include a shared understanding of our new normal and its impact on mental health. I'll also discuss risk factors and the implications if they're not addressed. I'll share some examples and the benefit of protective factors, as well as talk about assumptions and strategies for self-care. Looking at our new normal, we're all impacted by what's happening in our world. COVID has disrupted many aspects of our life. We're finding ourselves having to adjust and pivot to this new normal. Certain aspects of our life are very different now, and we're having to make changes that we never thought we would have to make. Some of those changes may come from misinformation. This is when we're taking information out of context and then spreading that information. Or uncertainty, like the new strand of COVID, or uncertain about the effectiveness of the vaccine. Physical distance. Should we be 6 feet apart versus 3 feet apart? Outside or inside dining? Even the gym regulations. Information overload. What do we do with all of this information that's coming in from various sources? Social isolation. In some cases, physical distancing or quarantine is causing social isolation. And we have financial pressures. We are still seeing an increase in our bills, yet there's been a decrease in employment and wages have been lost. And finally, altered daily routine. And this may be both for our work schedules as well as our childcare schedules that have had to change. These are just some of the daily changes. There's also daily life changes. These are just some of the changes that you may expect to see. And as we look at this list, these are some of the changes that we may continue to deal with as we navigate this new normal. Some of the things may include when we're going into different establishments, they're doing a temperature check. We're all mandated to wear masks, especially here in California. When you're out in public, we're seeing staggered school schedules, school days, and smaller classroom size. They're even setting up the floor plans so that we're able to physical distance within the workplace and in schools. We're seeing empty stadiums and concert halls. There's even contact tracing that's happening. There's limitations on the number of people that are traveling via buses, trains, subways. We're also seeing changes in airports and the rules for traveling and the limits for international travel. When we go to restaurants now, we even see that certain restaurants have QPR codes for their menus, and their servers are wearing masks. On a personal level, we are also seeing changes in our routine for children as well as adults. For our little toddlers, they're in need of time and attention. Our school-age children, they may be lacking structure and missing their peers in that routine. Many have had to access their schoolwork virtually, while our teenagers are also missing their peers, the social interactions, as well as the celebrations that they might be normally participating in person. For parents, they may be juggling childcare as well as caring for aging parents. Grandparents, they may be quarantining with you, or they may be quarantining by themselves. For those seniors, they're missing their social circles. With underlying health issues and compromising immune systems, they may have been forced to quarantine and have a change in routine. We know that changes are not always easy. And with changes come a number of feelings and emotions that we have to manage. Some of the emotions, thoughts, and feelings that we could be experiencing due to these crises that we're currently in are sadness, anxiety, and depression. There's fear and worry about our own health and the health of our loved ones. There's even changes in some sleep patterns or eating patterns. There can be difficulty concentrating. There can be increased chronic health problems or increased alcohol, tobacco, or drug use. And finally, loneliness. During this pandemic, you may be experiencing stress, anxiety, fear, sadness, and loneliness. And some mental health disorders, including anxiety and depression, can worsen. Dr. Marissa Franco, she describes 3 types of loneliness as the first one being intimate loneliness. This is when a person craves intimate relationship, that best friend. The second one is relational loneliness. This is just above the intimate sphere. This is when a person craves that relationship. This is that general relationship or friendship, or it can be that work friendship. And the third one is communal loneliness. This is when a person is missing that large affiliation that is attached to a sense of purpose or a sense of community. It can even be that Tuesday morning water aerobics class at the local gym or the recreation center that's no longer happening. The sense of loneliness, if it's not addressed, it can lead to mental health challenges. Loneliness is a risk factor, and it can also be a gateway to a mental health issue. Since the pandemic, mental health issues have soared internationally, impacting our children, our youth, adults, and seniors. With this increase in mental health challenges, we must be mindful of mental health risk factors. When we talk about mental health risk factors, we want to begin with a shared understanding of risk factors. So when we talk about risk factors, those are variables that increase the chances of negative consequences. For instance, chronic alcohol drinking, that increases the chances of liver disease. Smoking increases the chances of lung cancer. So since COVID-19, some mental health risk factors include stressful life situations. And this can be due to financial problems. It can be a divorce, a death of a loved one, chronic medical conditions, traumatic experience, whether it's an accident, illness, or again, a death of a loved one, abuse of alcohol or recreational drugs, as well as child history of abuse and neglect can be a risk factor. And just the mere fact of fewer friends or healthy relationships or the lack of social connections can be a risk factor. The positive side of risk factors is the presence of protective factors. And protective factors are those buffers that help to reduce or mitigate the risk factors by putting in place support, resources, information. All of these different things help us to increase the chance of positive outcomes. The key reminders to implementing protective factors are really looking at the way we're practicing self-care as well. So some of the key factors are awareness, being attuned to one's needs, limits, emotions, and resources. Knowing when you've put in all that you can, you've done everything that you can possibly do, and being at peace with that. This is when we are practicing self-acceptance. Balance, maintaining balance within our daily activities, especially work, play, and rest. Here is when we're practicing self-care. And finally, connections, which is extremely important during these current times. Here is when we're maintaining supportive relationships. Communication is part of connections, and it breaks the silence of unacknowledged pain. These connections help prevent isolation and increase validation and hope. Social connections is a key protective factor. Positive and supportive social relationships and community connections can help to buffer the effects of risk factor in people's life. Social distancing does not include excluding connecting. We have to be creative and think of different ways that we have to connect now that we have this new normal. Our new normal will require us to be more intentional about connecting. With physical distance, technology is a very important tool to utilizing during the times of quarantining and social distancing. It's important that we check in on family and friends and others on a regular basis to provide support and to be supported. We encourage you to utilize resources such as hotlines to reach out if you need mental health support and to assist with essential needs. One key component to self-preservation and self-care is to focus on areas that you're able to control and let go of those that you cannot control. For instance, I can control my positive attitude. Turn off the news is something that I can do. I can also choose to wear my mask versus those areas I cannot control, as far as how long is this pandemic going to last? People are not social distancing or other people's actions. This information that I'm about to share is adapted from the American Foundation for Suicide Prevention. Another way to practice self-care is to take note of our own mind, body, soul, and surrounding or environment. By doing this can help to reduce our stress. So for our mind, you might want to have a daily routine, set a goal, make a checklist. For your body, you might want to take a walk, do some exercise, set a sleep routine. For your soul, ask for help. Donate to a cause. Tell someone that you love them. For our surrounding or environment, make your space comfortable and safe. Display something you like to look at. Again, these are things that we can control. And these are things that really help to promote self-care for us. The assumptions about self-care are that it takes too long. Self-care is for people who can't handle stress. Or, I'm a mother, I'm a woman, I'm a professional. I don't need self-care. All which are so far from the truth. Self-care is self-respect and self-love. For those of us that may need a quick reminder to practice self-care on a daily basis, I invite you to make a selection from this self-care menu. If you are short on time, take a 3 to 5 minute body stretch. Maybe before going to sleep, you can journal for 10 to 15 minutes. Or if time, the weather, or conditions permit, take an outside walk for 20 to 30 minutes. Whatever you do, please remember to take care and take time. Thank you for participating in this training. This is our email. If you have any questions or would like additional information or trainings, please contact us. Be well.